We want to bring you the latest information on the COVID-19 virus in our community. Now, we are now 1 week into phase 3, and we're moving forward as part of our reopening plan. I begin with a word of thanks to everyone for helping keep Nashville safe. Your support has gotten us to this point, and we need you to stay vigilant. This virus is going to be around for a while, and we will continue to execute our plan to protect the health of all Nashvillians. This morning, our metrics look promising, and we're hopeful this trend will continue. Dr. Alex Jahanger will get into more detail in a moment. It's critical that we continue to follow the science and the data. It will inform every decision that we make. It's also been clear that Nashville has been a leader in flattening the curve in Tennessee. Back in July, we were the worst county in the state with new cases per 100,000 residents. Today, we rank 81st lowest out of 95 counties. In July, our cases per 100,000 were 64. Today, that's 1/4 of that number. In July, we had 5,800 active cases. Today, we are 1/5 of that number. Now, you may remember in the early summer, the urban and suburban areas saw most of the active cases, but things have changed. Now the virus is spreading more in the rural areas of Tennessee. The White House warned us. In July, Dr. Birx told us to wear masks, practice social distancing, and temporarily close bars and other businesses that could facilitate the spread of the coronavirus. She told us we needed to take action. And actually, by the time of her visit here, Nashville had already implemented all these public health protocols and more. Dr. Birx warned that it would take time to see results, so early action has allowed us to get the improved public health conditions we see today. We've learned a lot since the pandemic first hit Nashville, and as a result, we changed our behavior. We know wearing masks work. We know social distancing works. We know limiting the size of gatherings works, and getting tested works. At the same time, we also know that some businesses are suffering. Workers have lost their jobs. Small businesses have been hit hard. And that's why the more we continue to focus on the reopening plan, and the more we're going to get it right. We're doing everything we can to bring people back to work safely. We're also committed to helping our small businesses through the CARES Act funding. On Tuesday, the Metro Council approved our plans to provide direct assistance to our community partners. $2 million of the federal relief aid will go to direct grants for small businesses, and another $2 million will go to direct grants for live music venues. You can get all the information about how to apply on our website at covid19.nashville.gov. Pathway Lending will be administering these funds, so business owners need to get the information and apply for this relief. In addition, $1.5 million of the CARES Act funds are earmarked for other programs to support small businesses. These programs will be administered by the Nashville Business Incubation Center, the Nashville Entrepreneur Center, Conexión Americas, and the Nashville Area Chamber of Commerce. Small businesses are a big part of what makes Nashville great. They are vital to our community. When they thrive, the city thrives. And I salute those who work in small business or own a small business, and I will stand with you and fight for you as we get through this pandemic. Today, we have 2 owners of local businesses who have worked hard to provide their customers and employees a safe place to shop, eat, and work. Kimberly Lewis is owner of Emerson Grace, a clothing and accessories boutique on 12th South. And Pat Martin is founder of Martin's Barbecue Joint and Hugh Baby's Barbecue and Burger Shop. Thank you for coming in today, and we'll hear from you in a moment. We'll also hear from Dr. James Hildreth, president of Meharry Medical College. And finally, starting today and every week, I want to put the spotlight on a local community hero, someone who is an example of helping others, and someone who is an example and an inspiration to others. Today we honor Cody Hamilton, a nurse at the Vanderbilt University Medical Center COVID-19 unit. From the first days of the pandemic, Cody has been fighting on the front lines of the virus. Most people don't ever see what Cody sees. Most people don't ever deal with the challenges that he has to face and on a daily basis. Cody and his colleague provide a special combination of hope and healing. They are a lifeline for families of COVID patients who can't visit their loved ones in the hospital. Cody and his fellow healthcare workers are examples of the best this city has to offer. Thank you, Cody, and thank you, healthcare workers, for your service to our patients and this community during this crisis. You're saving lives. You are making a difference. And now I'd like to turn it over to Dr. Alex Shahanger, Chair of the Metro Coronavirus Task Force.